Peace be to you all. Assalamualaikum. Omar here, physician associate, health educator, and endurance athlete. So this is going to be a PA-oriented video. So I wanted to talk to you guys who are applying to PA school very briefly about the difference between direct patient contact hours versus PA shadowing hours. So there's a few distinctions. Number one, a lot of schools, PA schools anyway, want you to have these direct patient contact hours. I don't know if that's the same for medical school and NP school. You would have to ask people in those professions about that. But for PA school, what's happened in the past several years, at least this is after I graduated, more than 20 years ago, students are required to have direct patient contact hours. Usually the schools want the students to have something in a professional level career, so a certification of some kind. So at minimum, I would say something like a certified nursing assistant. That's what I did before PA school. So that required me to actually be in a program. So it's a CNA program. It's, I think mine was about 5 weeks. Then I had to take a certification exam. So you're actually working as a professional in the healthcare field and getting your direct patient contact hours. Other good options are phlebotomy. I would suggest something quick if you're doing a degreed program like biology, something that's not in the allied health. If you're doing nursing, like a BSN program, then you're going to get your direct patient contact hours through your training as you do your rotations. You'll have more than enough by the time you're applying to PA school. But if you're doing a straight science degree, biology, biochemistry, chemistry, or even English, because you don't have to major in a life science degree to apply to PA school. I'll talk about that later. But for your direct patient contact hours, the schools often want you to have something in an actual certified allied health field. So again, CNA, phlebotomy, a medical assistant. Medical assistants, I think that requires, that's usually a very intense 6 to 12 week training program. Some of them are as long as a year, depending on the program. Then maybe an EMT, emergency medical technician, or anything where you're working in the field as a certified, licensed allied health care provider. Now, this looks good on your application process, on your application to PA school. You'll also have something to write about for your personal statement, and you get a lot of good experience. Now, for PA shadowing, that's a bit different. That's where you're following a physician associate. I still, it's kind of hard for me to say that. I've been saying physician assistant for 20 years now. But you're following a PA in their work setting. So whether it's a hospital, a clinic, or a doctor's office, I'm here in a private doctor's office. You have to check with the healthcare facility in which you'd like to shadow that PA, because a lot of healthcare facilities no longer allow it because of COVID. COVID's put a damper on a lot of shadowing opportunities for PAs. Or just with HIPAA compliances, a lot of facilities become a lot more stringent on opportunities for students to shadow them. And it's kind of unfair, but it's to protect the hospital from certain legalities. Back when I was applying, you could just go to any hospital and ask to shadow a doctor, and usually the doctor would let you. But now administrative folks get involved, and if it's against hospital policy, you may find yourself out of luck in terms of being able to shadow a PA in the hospital. So in that case, you might want to look at maybe a doctor's office, or even some PA-owned practices. There are a few in the country where the PA may let you shadow them. That's valuable. I would suggest that for any PA student to try, or pre-PA student rather, try to get as many shadowing opportunities as you can to see where we work. Most of us work in primary care settings, but a lot of us work in surgery. There's aesthetics medicine, so in different clinics. Some of us work in research even, or in academic settings. But you probably want to get something where you're going to get hands-on with patients if you can. Some things to be wary of. I wrote them down. If you're looking for shadowing hours for a PA, you want to, number one, make sure that the PA is licensed. Hopefully they're certified and licensed if they're actually working. It's illegal not to. I've never heard of an unlicensed PA working. For your part, you want to make sure that you have a certificate showing that you've had HIPAA training. So that's the HIPAA, the things dealing with patient privacy. I think that stands for Health Insurance or Health Information Portability Privacy Act of 2006. I always forget the acronym. But make sure that you have a certificate showing that you had some type of HIPAA training. That's always helpful. And then, because you don't want, the last thing any PA like myself would want is some student, you introduce them to a patient and they go out, they're taking pictures of the patient and talking about the patient's privacy and breach of violation. That's got to get everybody in trouble. Unfortunately, some students, it was residents, my God, it was these, they had finished medical school, so they got all the way to residency, and one of them took a picture of themselves with a dying patient, and they gave the thumbs up sign or something like that, and then posted it to social media. I don't know why anybody would do that. So they were kicked out of residency, so they basically blew their medical careers before they even started. It's important to us that are allowing us licensed and certified professionals that are allowing pre-professional phase students the privilege of following us, that they're going to follow good ethics and be respectful of the patient's privacy. So you really need to get trained in that and show proof of that training, so we can be assured that you don't do anything that would be a breach of that patient's privacy. Also, in this age of COVID, you want to make sure that you have proof of COVID vaccinations. It's a good idea to have been tested before you shadow a PA. They may want proof that you're negative for COVID, and then have an official form. So a form for us to fill out, whether that's from the PA program to which you plan on applying, or the form from whatever school with which you happen to be affiliated. So that's it. Those three things are pretty important. And then if you're going to shadow, usually you're going to wear scrubs or professional attire, and certainly helps to have a white coat, depending on the setting. But if you guys have any questions about that, again, those of you guys that are pre-PA students or actually in PA school or about to start PA school, you can reach out to me. I'll leave my contact information in the description. I wish you guys the best of success in your positive endeavors. The PA field it's a great field. All of the fields are great, but the Lord chose me to be a PA. I would not have stuck with it for more than 20 years as I have if I didn't enjoy it. So I look forward to hearing from you guys. You can leave any questions or comments you have in the comments section, and I'll try to answer them as quickly as I can. Take care. Peace.